So right now we're going to do a urine dip. What we do is we just bend it in there a little, make sure everything gets covered in urine, and you wait a minute for all the, hopefully nothing to come up. And what we read on here and the sides, pick it up. First thing is specific gravity. Now specific gravity is just really another word for density, the density of the urine. A normal range is about 1 to 1.3. Right here we're perfect 1.01. So if a higher specific gravity means that there's going to be more in the urine. The pH right here, perfect, 5. A little low, maybe 6.5 is about normal. Leukocytes means that they're going to be a UTI infection usually, because leukocytes are those white blood cells that fight off infections. So if those get into the urine, that you got an infection down there. Nitrites come from a breakdown of nitrate by bacteria. So presence of nitrites might mean that there's some bacteria causing a UTI. Proteins, that's going to be kidney damage usually caused by high blood pressure, maybe diabetes. The kidneys should be filtering out all these large proteins, so if they're coming into the urine, you know that there's something going wrong with the filtering. The next one's glucose. Now he's testing high for glucose, about 1,000 milligrams per deciliter. So that means that he's got diabetes. If you get glucose in the urine that's this high. Ketones, that's going to be kind of an exercise-based thing that you'll find in the urine. When the body doesn't have enough glucose to break down, it starts breaking down body fat, and ketones are made and can get into the urine there. Urobilinogen is the next. That comes from the breakdown of bilirubin from the liver. If there's a urobilinogen in the urine, you know that there's probably a liver problem. Same thing with bilirubin here, also negative. Just shows that there's possible liver problem, possibly hepatitis. You might see some jaundice in the patient if you get something like this. Blood, negative on blood in the urine. You're going to look at hemoglobin. Again, hemoglobin test negative. That's going to tell you if there's a UTI or possibly kidney infection.
So what do you do here at the HSC Healthcare Center?
At the clinic, we basically get to sit in on patient visits, help stock exam rooms, and enter patient physicals into the system.
So on a daily basis, I'm always the first one at the clinic. I meet with the staff and the MAs, and just chat it up for a while before we see our first patients. I also shadow Dr. Hoban when there's patients available. Dr. Moody is great too. We love to shadow her, and I just help out where I can.
So here at the HSC Healthcare Center, I shadow doctors and other healthcare professionals. I also help with stocking fee sheets and data entry.
Every day when I come in, I talk to the MAs and see if they need help with anything. We go over the patient plan for the day, so if they have anything they need me to do, like usually billing or data entry, I do that. And when there's a patient here, I do whatever I can to get involved, so I shadow the doctors and help out with that.
What have you learned here?
So far I've learned how a basic doctor's office is run and what daily tasks each employees do.
We're learning a lot of different things from this internship. Everything from bedside manner to how to treat some of these more complex conditions that we see at the clinic. It's interesting to understand how medications work and what medications do specific things for a patient.
So I've learned a lot about the common cold. One thing I've learned is that you have to wait 7 to 10 days before going into your doctor with this. That's about how long it takes before they can prescribe you any antibiotics such as amoxicillin.
I'm learning a lot, really. Not just diseases and treatments, but I've learned a lot about myself and what I want to do in the future. When I came into this internship, I was kind of shy, and I didn't know if I wanted to be a physician for sure. I thought that my shyness might limit me to becoming a surgeon or something where I just didn't have to have that much patient contact, because I didn't know how I would do. But I've grown a lot since then. I think I'm a lot better at talking with patients, and I think that I want to go into pediatrics because of just some of the kids that I've seen that are awesome.
What is the most unique thing you've seen?
Something interesting I've seen here was a suture removal, and basically what was really cool about it, I got to see the before and after pictures of the thumb and how infected it was, and then after it being drained, and then overall the healing process of when the sutures were removed.
So we saw a cyst removal, Matt and I, in the month of September. It was a little interesting. It was on the top of a gentleman's head. Very cool to see that process take place and see the whole process from start to finish.
So the most unique thing I've seen is an ingrown toenail removal. I was able to watch the doctor numb the toe with lidocaine and then also cut out a large portion of the toenail.
I'd say that the most unique things that I've seen is probably some genetic diseases that I've never even heard of before. Dr. Hoven and Dr. Moody have admitted to me that they have some patients that they don't know a whole lot about their genetic diseases. I've seen some patients with Charcot-Marie tooth, alpha-1 antitrypsin deficiency, Fabry's disease, and we always go over those together. And the greatest part is that the patients really teach you a lot.
What interests you the most?
What interests me is getting to see how a doctor will act different around each patient, and how the environment is completely different around kids compared to adults.
I like seeing the orthopedic cases that come to the clinic. We've had an array of bone injuries and bone abnormalities come through the clinic. It's always interesting to see somebody who has a little bit of a abnormality with their bones.
So something that interests me the most is learning about the different medications and what they're used for.
I'm pretty interested in the process. I like when patients come in with some sort of common disease. I've seen a lot of symptoms like sinusitis and bronchitis, so I know a lot about them now with experience. So whenever they come in, I like to think in my head what kind of treatment I would give them and what they need to do to get healthy.
What do you like about the physicians?
Everyone here is so nice and inviting, and I love how all the doctors always answer our questions, helping us learn more.
The physicians here are absolutely awesome. Dr. Hoven makes an effort to send patients out with information every time he sees a patient, whether that's written or that's very, very detailed verbal information. He makes a great effort to educate the patients.
Physicians.
So the physicians are all super friendly. It's so amazing that they allow us to follow them and shadow them. What I like most about them is all the things that they teach us.
Every day when I come in, I see two physicians, Dr. Moody and Dr. Hogan. And what I like most about them is how they help me learn. When I have a patient with a less common condition, Dr. Hogan always prints off something for me to read about, so I have some background knowledge going in. And he always asks me if I have any questions afterwards. Similarly with Dr. Moody, she likes to get on her laptop and pull up the up-to-date database, and we read through the conditions together. So if I have any questions about what I'm reading, she can explain it to me.
In what ways can you apply this to your future?
So far my plan for the future is to become a nurse practitioner, and so getting to follow our NP here, Jess, around is really helpful into seeing what things I could be doing daily, and then also what part of the field I want to go into.
Bedside manner is the biggest thing that we can apply to our futures. Learning how to communicate and interact with patients is a huge deal in medicine and in our further education.
So I feel that this internship has definitely prepared me for my role in the medical field. It has most definitely given me an advantage in solidifying what I want to do in my life.
I think that this is a great opportunity for me, especially at a young age. So I think I'm getting a lot of experience with diseases and treatments for them. A lot of things I'm going to learn in med school, so it's great to have a head start on that.